Today's topic of discussion is wound healing, repair and regeneration of wound. First, see that anatomy of skin. Three layer. Outermost layer name is called epidermis. Just below epidermis we have dermis. After that we have subcutaneous tissue. So in this outermost layer epidermis, it having five thin layers. What are the five thin layers? Stratum basilae, stratum spinosum, stratum granulosum, stratum lucidum and stratum cordium. These are the five thin layer presented. These five type of layer we have two type of cells. In this one we have two type of cells. What are the two cells? Melanocytes and keratinocytes. Melanocytes are the cells which secrete melanin. So melanocytes, these cells secrete melanin. Melanin as a pigment that gives color to our skin. So what is the role of melanin? Gives color to skin and protecting skin from effect of from UV light. Protecting skin from the effect of UV light. Second one is keratinocytes. Keratinocytes is a cell which produce keratin. Keratin is the water repellent protein make epidermis its hard and productive quality. So that is the two type of cells. Five different type of thin layer and two type of cells. Melanocytes and keratinocytes are presented. Just below the epidermis there is dermis. Inside the dermis there are multiple collagen, elastic fiber, nerves, fibers, blood vessels, sweat gland, sebaceous gland, hair follicles. All these are present in dermis. Multiple collagen, elastic fiber, nerve fiber, blood vessels, sweat gland, sebaceous gland, hair follicles are presented in dermis layer. Just below the dermis there is subcutaneous tissue. Subcutaneous tissue made up of fat. So that is subcutaneous tissue. Let's start healing. What is healing? Healing is the body's response to injury. Body's response to injury in attempt to restore the normal structure and function. So to restore normal structure and function of the skin. So healing is the body's response to injury to attempt to restore the normal structure and functions of the skin. So whenever there is the injury on the skin, so body's ability or body's response to restore the normal structure and functions of skin is known as healing. Body's ability or body response to restore the normal structure and function is known as healing. The main thing is that healing is similar in all tissues. So healing is similar in all tissue. It is independent on the mode of injury, whether it is a blood injury or whether it is a sharp injury or deep injury. It is same in all. So healing is similar in all tissue. Let's coming on that healing. There are two process of healing. One is regeneration, second one is repair. What is the difference between repair and regeneration? regeneration is the parenchyma replaced by parenchymal cell. So parenchymal cell is replaced by parenchyma cell of that same type. But in repair, the parenchyma cell which is lost, it is replaced by fibrous tissue. In regeneration, restoration of that normal structure and function is possible. Restoration of normal structure and function is possible. Repair parenchyma which is lost, it is replaced by fibrous tissue. Then restoration of normal safe and function is not possible. Here is not possible, and repair ultimately scar is formed. So here regeneration means restoration of normal structure and function is possible, but here not possible. Ultimately scar formation will occur. Let's see, this is the normal structure. If the injury superficial, if that injury is superficial, so whenever cell lost from that area, it is replaced by that same cell. Parenchyma cell means here same parenchymal cell. So again the structure is resumed. The same structure and function is restored in regeneration. So same structure and function is restored in regeneration because the injury is very superficial. So whatever cell is lost in that injury, they are replaced by same type of that cells. So that process name is called as this one, regeneration. See that repair, this one is contrary. See that repair, what is happening in that repair? The injury is very deep. So here injury is very deep. The injury is very deep. So here whatever cells lost, so here whatever cell is lost, they will never come again. So here the same cell is not come again. They will never be restored. So instead of that collision, that means scar will be coming. So here new type of cell will come. So scar formation. So end of that result here, scar. It cannot restore the normal structure and function again ever. So that is the difference between regeneration and repair. Same type of cell will come here, but here different type of cell will come. So here cannot restore the normal structure and function. This is the main difference between repair and regeneration. Let's see the steps of repair in detail. Repair is that replacement of injured tissue by fibrous tissue, that is scar. It is not the same tissue coming. Instead of that tissue which is lost, instead of that we will get fibrous tissue at that end. So new type of tissue we will get end. Steps of repair, there are 3 steps in repair. There are 3 phases actually. First phase is called inflammatory phase. Second one is called proliferative phase. Third one is called this maturation. First phase, that inflammatory phase, there are 2 things which will happen. One is clot formation, second one is inflammation. That is known as inflammatory phase. In proliferative phase, 3 things takes place. One is epithelialization, fibroplasia, angiogenesis. Epithelialization, fibroplasia, angiogenesis. At the end stage of proliferation is granulation tissue. End stage name is called granulation tissue. Third stage end result name is called result is called scar formation. Let's start that phase 1, inflammatory phase. As soon as injury occur, okay, cut over by hand immediately for that first, from day 1 to day 3 it will be inflammatory phase. See this diagram. This is epidermis. Okay, so this one is the dermis, this one is the injured area, this one is the injured area. As soon as that injury takes place, there is clot formation. So here clot formation, so lot of bleeding occur, and because of bleeding, clot formation, here platelet will come, clot formation. Okay, the platelet clot is formed, that is injured area. Clot formation occurred in injured area. After that the inflammation occur. Second one is inflammation will occur. We have blood vessels. From that blood vessels, neutrophil will leak out. Neutrophil will leak out in that injured area. These all cells are neutrophil. So first one is platelet clot formation. Here these are the cell neutrophil formation. These are multilopated cells. These are all neutrophil, and gradually that neutrophil are replaced by macrophages. First one is platelet clot formation. Second one is neutrophil will come. After that, that neutrophil disappear. Here macrophages replaced in this stage. You see all these cells are macrophages. This one all macrophages. The nucleus is not multilopated. The nucleus is mononuclear. Here the presented nucleus mononuclear. So first neutrophil are these, followed by macrophages. Neutrophil followed by macrophages. It is clearly visible in the diagram. First one is clot formation, neutrophil. Third one is macrophages. What is happening that inflammatory phase? Within the second of this injury, epinephrine nor epinephrine will come in the role. That is sympathetic stimulation will come in the role. It will cause us vasoconstriction. Because of this vasoconstriction, the endothelial cell will retract and subendothelial tissue will be exposed. So platelet addition, activation and aggregation. Ultimately the platelet clot, that is primary clot, which result in the formation of secondary clot, that is fibrin clot. So ultimately the clot is formed in first step. So the primary clot, then secondary clot is formed. Simultaneously first release the neutrophils, which is followed by these macrophages, which leads to inflammation. So second things happening simultaneously. On the one end there is homeostasis, that is clot formation, and another end there is inflammation. So these are the first here homeostasis, second one is that inflammation. So these are the two things which takes place in first phase, that is inflammatory phase. So two things will happen, homeostasis and inflammation. A second phase is proliferative phase. Have three things takes place from day to 3 weeks, 2 days to 3 weeks. This will happen and end result is granulation tissue. What is epithelialization? This is the diagram. See this diagram. Here moving and meeting at the center. So epithelialization here, moving and meeting at center. This is that injured area. So epithelium was lost. But the last epithelium is coming from both sides. So from last one coming from both sides, meeting at the center, that is known as epithelialization. So proliferation and migration of epithelial cell from proliferation and migration of epithelial cells from both sides to meet at that center, to cross that midline, to meet at that center. This is called epithelialization. So now the first cell for that neutrophil formed by these macrophages. So here macrophages formation. This one is the macrophages. Now next cell will come are that fibroblast, that spindle step. First macrophages will come, second one is fibroblast will come. Once that fibroblast will come, there they start forming collagen. So collagen formation will happen, that is known as fibrogenesis. Second process, collagen will come, no, that spindle step collagen, that name is called as fibrogenesis. And last third thing, angiogenesis. What is angiogenesis? This one is the old blood vessels, here new blood vessels formation. Angiogenesis takes place. At the end result, all of this name is called as granulation. So epithelium moving here and meeting that center, spindle shape fibroblast will come and form collagen. Then angiogenesis, new blood vessels will form. So angiogenesis, third step, new blood vessels formation and support of healing wound environment. So here these are the stimulus. Main stimulus name is called this one, VEGF, vascular endothelial growth factor. Vascular endothelial growth factor is the important stimulus. So neutrophil replaced by macrophages. Macrophages after that fibroblast, then fibroblast producing collagen, random laydown of collagen. Then last stage name is called as maturation. Here maturation, in this phase fibroblast will also leave the wound. First neutrophil will come, will coming, then there are going, then macrophages will coming and there are going, then fibroblasts are coming. Now they are also going. Now only collagen is present. Okay, so only collagen is present and everything is gone. Collagen is present and organized matrix, that name is called as tensile strength. This one maximum 70 to 80 percentage on wound will increasing up to one first year, it will maximum but never 100%. So not recovered 100%, maybe previous cell. Here 72 maximum strength is 70 to 80% of normal tissue. This tensile strength never reaches that normal strength of unwounded tissue. 100% there, here only 70 to 80%. End result of that maturation, scar will form. Next, a healing of skin wound. It takes place by two mechanisms. First one is healing by primary intention or primary union. Second one is healing by secondary intention or secondary union. This first diagram, injury is here small, but here injury is superficial and big. Here little granulation tissue. Here abundant granulation tissue formation at this end. So this is the primary and secondary wound healing. What is the difference between primary and secondary? Here that wound is clean, here unclean. Here infection, uninfected, may be infected. From outside very neat, this one is very neat, here dirty. This here suture is that scanty granulation. We know here scanty granulation, here abundant granulation tissue. So complication infrequent, this one is the frequent. Here that outcome neat line scar formation, here contracted irregular because of abundant here, okay, abundant amount of presented, abundant granulation tissue is presented, so contracted. These are the two type of healing, primary union and secondary union. Thanks for watching.